Ever pondered over what the leading cause of death globally might be? It is, in fact, heart disease. A term encompassing a variety of conditions affecting the heart and blood vessels, heart disease is a formidable global health concern. But what causes heart disease? What are the risk factors? Let's break them down for a clearer understanding. First up is age. As we grow older, our arteries may narrow and lose flexibility, increasing the likelihood of heart disease. On to family history. If close relatives like parents or siblings have had heart disease or heart-related conditions, the risk elevates. Then, there's smoking. A significant risk factor, smoking inflicts damage on blood vessels, reduces the heart's oxygen supply, and leads to the formation of artery-clogging plaques. High blood pressure or hypertension is another factor. It forces the heart to work harder and can result in the thickening and narrowing of arteries. Next, we have high cholesterol. High levels of LDL, the so-called bad cholesterol, and low levels of HDL, the good cholesterol, can cause plaque buildup in the arteries. Diabetes also plays a role. Higher blood sugar levels can harm blood vessels and nerves controlling the heart. Obesity is another risk. Excess body fat, especially around the abdomen, can lead to high blood pressure, high cholesterol, and insulin resistance. Physical inactivity, too, can lead to obesity and increase the risk of heart disease. An unhealthy diet, rich in saturated and trans fats, salt, and added sugars, can contribute to high blood pressure, high cholesterol, and obesity. Chronic stress can lead to unhealthy behaviors, such as overeating, smoking, or excessive alcohol consumption, which can raise the risk of heart disease. Excessive alcohol intake can raise blood pressure, contribute to obesity, and increase the risk of heart disease. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, is associated with an increased risk of hypertension and heart disease. And finally, inflammatory conditions like rheumatoid arthritis and lupus can increase the risk of heart disease. Now, while this list may seem daunting, remember, many of these risk factors are modifiable. Lifestyle changes such as adopting a healthy diet, getting regular exercise, quitting smoking, and managing conditions like hypertension and diabetes can make a world of difference. Early detection and appropriate medical management can also help reduce the risk. Regular checkups with a healthcare provider and adopting a heart-healthy lifestyle are essential for heart disease prevention. So take heart in knowing you hold the power to mitigate these risks and lead a healthier life.